Good morning, good afternoon, good evening, whenever you are viewing this. It is wonderful to have you here for me to discuss the cardiovascular system. Ooh, my heart is beating so fast because of that. Get it? Okay. Let's get started. So, the cardiovascular system has essentially four components: your heart, the pericardium, which is, remember from medical terminology, oh, this is medical terminology. This is why you learned all the prefixes, right? Peri, around, cardi, heart. Okay. All right. And then you have your arteries, which is the blood flowing from the heart with oxygen, oxygenated blood from the heart to everywhere, every single cell in the entire body to feed it. You've heard the phrase oxygen starved. Well, exactly. Your body, every cell in your body requires oxygen to live, to thrive, to do its job. Okay. And then once it's done, the veins pick up all the waste matter and carry deoxygenated blood back to the lungs, the pulmonary system, to get oxygen, and then head on back to the heart to start all over again. Okay. Isn't it amazing? It really is absolutely amazing, the engineering that is involved in how the human body works. And for medical terminology, you need to become familiar, again, either with the words or the prefixes and suffixes and roots, so you can figure out a word that you're not familiar with. See, so you might want to go back and review weeks 1 and 2, where you learned a lot about the prefixes, the roots, and the suffixes to help you. And then, of course, you're going to have those terms like heart, arteries, veins that don't have parts. You just have to remember what they are. And again, this is going to tie back into what you learned in anatomy and pathophysiology. Okay, because medical terminology is the language of the human body, of healthcare. And this is what we call stuff. Okay, does that make sense? I hope so. If not, email me. All right, so the heart, and you can see the picture. It's interesting that the heart is not heart shaped, right? Okay, so this picture is explaining. Now, I had a student many years ago who said that the blood is red in the arteries when it's oxygenated, but it's blue blood when it travels through the veins, deoxygenated. That is not true. And when I told her that, she said, no, look at the illustration. You can see red blood and blue blood. Okay, that is only done for you to be able to see the comings and the goings, the oxygenated from the deoxygenated. And it is not going to be blue blood. That's the TV show, Blue Bloods. Okay. All right. So normal is 60 beats per minute, which is what? 1 beat per second. Each beat is a compression. That's when the nervous system, the autonomic nervous system, tells the muscles around the heart, contract, release, contract, release, contract, release. And when it contracts, it squeezes the atrium to put the blood into the ventricle, or the ventricle to send the blood out. Okay. So that is really how it works. So now, when you go to the doctor and they look at your heart rate, if it's much lower than 60 beats a minute, that would be hypotension. And if it's faster that's going to be hyper. Okay. Tachycardia means rapid heartbeat. Tachycardia is what you feel when you look at someone you love. Quick heartbeat. Brachycardia, slow. That's probably what you get when you're bored. Okay. Brachycardia, tachycardia. Think about that dial on your car dashboard, you know, not the one that tells you your mileage, how fast you're going, not the speedometer, which tells you how fast you're going. The other dial is known as a tachometer, which tells you how fast your engine is going. And so that's very similar to tachometer, speed, measuring the speed. Okay. So look at all these words you're learning. You guys are just so smart. All right. So the heart has chambers. The atria, which is plural of atrium. So there's a right atrium and a left atrium. Remember, it's always the patient's right and left. Okay. And these are at the top half of the heart. Then there are valves that control to keep the blood where it's supposed to be, okay? And there's a cardiac septum. A septum is like a membrane, okay? The atrial septum lies between the right atrium and the left atrium, okay? I know this might be a lot to take in, but what are you taking away from this? Atria, atrium, atrium, more than one, atria, multiple. And then that's at the top of the heart, okay? And then the cardiac septum is that membrane that lies between them to divide the right into the left. That's totally makes sense. Right? Right? Okay. The ventricles are the bottom half of the heart. Also right half, left half, also divided by a membrane known as the septum. This would be the ventricular septum because it's the membrane between the two ventricles, okay? So the blood comes in to the atria, and then your heart beats. So that's the contraction, opens up the valve, and the blood flows from the atrium to the ventricle. And then the valve closes, and the next lot of blood comes in. Okay. The heart beats, and the ventricle pushes the blood out. Just like the mechanics of an engine or something. I'm not really good at that. Okay. All right. The heart valves, these are between the atria and the ventricles, and they control and keep the blood where it's supposed to be. So the valve is going to keep the blood in the atrium when it's supposed to. It opens up and lets the blood flow into the ventricle when it's supposed to, and then it closes back up because you don't want any what they call regurgitation. In other words, you don't want the blood from the ventricle coming back up into the atrium. Okay, that's bad. And then this way, now the atrium can fill up again, and we start the process all over again. Okay. This, you may know somebody who had a heart valve problem, and the two most common problems are the valve not closing properly, in which case when the atrium fills back up, it leaks back into the ventricle when it's not supposed to. Okay. Or as I said, the regurgitation where the ventricle spits blood back up into the atrium. Now, like, so what's the big deal? So what happens is the blood sitting there longer than it's supposed to be may start to clot. And you don't want to clot in the middle of your heart because that's going to block things. And then you have a real problem because you cannot get blood flow through the heart. Not so good, right? So that's why this whole process has to move smoothly. Now, in recent years, they have done wonderful things about replacing malfunctioning heart valves. It's really very cool. Hopefully, you won't need to know about it on a personal basis. But the words of what is going on, the mitral, also known as the bicuspid valve, as I've said before, why they have to have two names, I don't know. They didn't ask me, but okay. The mitral valve on the left side and the tricuspid. So we have bicuspid on the left, bicuspid 2, 2, 2, 2. Okay. And then tricuspid on the right, which are then secured into place. So they don't go wonky, because you don't want that either. Okay. All right. The pericardium actually, now remember, peri around, cardium, the heart. Okay. So it actually has 3 layers to it. The endocardium, which is the innermost layer. And then we have the myocardium, which is the middle layer, and then the epicardium, which is the outermost layer. Okay. And that word that you see under endocardium, I'm just going to get there, okay, is the innermost layer constructed of epithelium and connective tissues. Epithelium, skin, right? And connective tissues, specialized cardiac muscle fibers known as Purkinje fibers are contained in the interior ventricular walls just below the endocardium. Inside this part of the heart, okay? Purkinje. I love that word. It's just so, you know. Okay, so you have a lot to learn about the cardiovascular system. Lots of terms for you to learn. What do I tell you? Don't sit down and try and memorize them. That's not going to happen. Okay, instead, review, review, review. Use that medical dictionary. So when you are implanting a term and its definition in your head, you are implanting the correct definition, not what, oh, I think I kind of sort of remember, or what my friend told me. No. Okay. And query when necessary. Query, query, query me, please. I love it when students ask questions. Okay, we're going to wrap this up. I have a hurricane coming, so but I'm here for you. It just may take me a little longer than the normal 24 hours to reply this week to your emails, but I'm here, and you can always contact Ms. Johnson. She's always happy to help. Okay, have a great day. Stay safe.